Hello, my friends. I'm Filip Prado, urologist from Brazil. I'm spending here in Cleveland Clinic this entire month of November with Dr. Petar Bajic. I hope I speak well.
Perfect.
Petar Bajic, one of the most exponents of sexual medicine in the world. He's a highly specialized professional in this kind of urology subspecialty. And I'd like to interview, before we introduce everything, I'd like to thankful for meeting me so warmly and paying attention with every kind of things and allow me to uh, observe every surgery and office consultation and everything. It's gonna be deeply grateful for me, and it's gonna be very interesting for my career and for my patients in Brazil. So I'd like to know a few things. First question I have for you is Cleveland Clinic is renowned as one of the best services in the world, especially in urology. And in sexual medicine, you have very good outcomes of the patients, especially in penile prosthesis. What do you think that contributes to that kind of results?
Well, first of all, I want to just thank you for visiting and for the opportunity to get to know you better. I mean, I think it's always nice and speaks a lot about the person when a visitor comes, and me as the teacher learns just as much from the visitor as he learns from me. So it was really nice to just be able to discuss challenging cases and discuss techniques and everything. So thank you for your visit, and I look forward to visiting you in Brazil as well. But to answer your question, I think, there's multiple factors that are necessary to achieve reliable and consistent quality and deliver the highest standard of care. The first thing is keeping up on the latest publications, the latest research, specifically for implants. That's the ways that we prevent implant infection, the ways that we take care of our patients pre-op and post-op, and also maintaining efficiency, because one of the very important factors in infection risk is the duration of the surgery. So for me, although I trained primarily penoscrotal, but also had some experience with infrapubic, I actually found that in my hands, and I think this is the case for many people, the procedures were much more efficient using the infrapubic technique. And once I felt that my technique was able to deliver the same quality of surgery via that approach, I was able to make that switch. And I feel like it's made a difference for me. But I think having a team at all levels that's engaged in trying to improve the quality of care for the patient, so that's not just you as the physician, but the nursing team, the people that clean the rooms, the administration, everybody working together to identify opportunities to do things better and safer is really the key to delivering high quality results very consistently. So we always have to remember the team.
Good. We can feel that entire team works well and like a symphony, and everyone knows how to do, what to do, and the exact time. And I hope, I feel that it's important for a good outcome. And you will have a study like from the microbiome and sexual health, and we have some clinical insights, but I think that's not for practice now. Tell me more about that kind of study you are beginning to deal with.
Yeah. So as we know, for penile prosthesis surgery, the most feared complication is implant infection. And we have a lot of, I guess, beliefs that are based on the way that we were taught that may be based on, I think, some flawed concepts and flawed information. For example, I think we all pretty much trained that a penile prosthesis is sterile when it's in the body, and that if it's exposed to any bacteria during insertion, or if the patient has some bacteremia due to another procedure, that if one bacteria gets on that implant, it's going to lead to a clinical infection, and that infection cannot be eradicated by antibiotics, and that the implant must be removed. But what's interesting is that a lot of these concepts are based on clinical cultures, which we obtain, in our clinical practice for a variety of reasons. But those cultures do not reflect all of the different types of bacteria and even fungi that exist in various areas of the body. For example, there were some interesting studies that came out and showed that if you took a urine sample from a normal, healthy patient and subjected it to a standard urine culture, and it showed no growth of bacteria, but then you took that same sample and incubated it for another, I think, 48 hours longer in both aerobic and anaerobic conditions, that you could find hundreds of different types of bacteria that are there. So just like in our mouths, just like in our bowel, there's bacteria and fungi that live everywhere in our bodies, and the surfaces of implants, including penile prostheses, are no different. So our research really has focused on characterizing what this microbiome looks like on the surface of urologic implants, including penile prostheses. And although this research is very preliminary and is not meant to be changing practice, we're hoping to identify some of the fundamental concepts that may allow for the development of next generation strategies to prevent clinical infection, not necessarily by preventing bacteria from forming at all, because many of these bacteria can actually be protective. They can form a barrier to prevent pathogens from adhering to implants, just like we know that in other areas of the body, protective bacteria, like even in the vagina of a premenopausal woman, lactobacillus is protective against UTI, and after menopause, when the estrogen is lost and that pH in the genitourinary tract changes, that you get less lactobacillus and you can get more colonization with more dangerous bacteria like E. coli. So we're still working to better understand what exactly is going on the surface of implants, but we know there are a variety of different types of bacteria and viruses that live on the surface of these implants. And what's another interesting finding was that actually the longer that a device has been implanted, the more diverse the community of bacteria on the device becomes. So over time, you get a whole ecosystem of different bacteria that are competing for resources and preventing the overgrowth of one single pathogenic bacteria.
It's good. I think that's the first step for new researchers, because we all high volume implanters of penile prostheses, we think that everything is sterile, but it's not. So that's the first step. I hope that you'll discover more things, and I hope that could change something in the future. We don't know yet. So let's talk about wellness and the risk of testosterone replacement, about patients who bought some kind of drugs in different pills and different pharmacies, not allowed. And this is a problem here in the US. We have this problem in Brazil, so big. You have this problem here.
So the whole testosterone space and market is one that has some, I think, major issues and concerns. I mean, really, we in andrology, our role is that we treat men who have a testosterone deficiency, who have symptoms, right? So the definition of hypogonadism or testosterone deficiency is that you don't just have a low level, but you also must have some symptoms that can be attributed to that. And if the only symptom is erectile dysfunction and the patient has a cardiovascular history, it's probably not from the testosterone deficiency. But I mean, this is really our role, is to identify patients who are appropriate for this therapy and then replace their testosterone to a appropriate level. Our goal is not to exceed that and put them in some superhuman or supernatural range. In the US, just like I'm sure in Brazil, one area that's controversial is testosterone enhancing supplements, which are non-pharmaceuticals, but various things that have been suggested to improve testosterone levels. And really in the US, I'm sure like in many places, supplements are not subjected to any sort of regulatory approval or regulatory testing. So there's actually no evidence, no solid high quality evidence to suggest that any particular supplements are valuable for improving testosterone levels. So in general, we recommend that our patients do not use these. Another area is that men who use androgens, testosterone-like compounds that are mostly not even meant to be used in humans, for the purposes of boosting athletic performance, boosting muscle growth, etc. Sometimes they use other drugs as well, like human growth hormone, etc. I mean, really, this is a whole different area that's not treating a medical condition, but is instead trying to pharmacologically augment their own anatomy and physiology. And our stance here at Cleveland Clinic and with the Sexual Medicine Society of North America that I'm on the board of is that we strongly recommend against using these kinds of substances for the purposes of improving athletic performance, etc. So we really want to reserve testosterone therapy for patients who are suffering from testosterone deficiency, who have symptoms that are attributable to that, and in collaboration with an experienced physician, make sure that that treatment is being delivered safely to appropriate levels with close monitoring of the potential side effects, including monitoring the blood count, monitoring the PSA, and also assessing for any other new symptoms that might happen. And the last piece that I think is unfortunately something we see far too often in the United States is that many practices who offer testosterone therapy either to men who are deficient or sometimes men who maybe don't meet the strict criteria often do not discuss with the patients that fertility can and will be negatively impacted by testosterone therapy. So we often see young men in our clinics who have been on testosterone therapy for years who are having difficulty conceiving and have never been told that the testosterone is playing a part in that. So it's absolutely essential and ethical for anybody prescribing testosterone or testosterone-like compounds to have that conversation with the patient about their plans for future fertility. And if the patient does desire fertility, the patient should be working with an andrologist who's experienced in treatments that do not involve testosterone, for example, HCG, anastrozole, Clomid, etc.
Clomid, yeah, for sure. We always say the same thing to patients, and patients always come for us with this concern about fertility.